Hi, everyone. Welcome to Freedom Friday. This is actually week 4 of Freedom Friday. And in case you're just joining us for the first time, Freedom Friday is a chance to just hear and get some insight into what WTO feels as an organization about certain things, or to give voice to people who maybe don't have a voice, haven't had a chance to share their story. Ultimately, the goal of Freedom Friday is for people to have a chance for themselves, whether you're a veteran, mil spouse, gold star spouse, civilian. We really just look at you as a human, and we want you to take this opportunity to internalize a message that could lead to just maybe a little bit more freedom. 1 degree week over week is going to lead to a lot of freedom over time. And so that's the point of this Freedom Friday series. I'm Gabe Erickson, the CEO of Warrior Transition Outdoors. Today I have a very special guest. She is our board member. She is a friend. She is, gosh, I don't even know how to like sum up in words, if there is a word in the English language to describe you, Britt. But Brittainy
Hmm.
Lindsey, everyone, thanks for joining us.
Thanks, Gabe. It is such a pleasure to be with you. I would describe myself in WTO as a mentor, an advisor, an advocate, and just somebody who is not a veteran, a civilian, but fiercely supporting everything that the organization represents and the vision and the mission, 100%.
It's so special, Britt, because when we first met you to now, like you have just been this constant source of love and energy and support and advocacy on your own, like looking outward, not just into the organization, right? For WTO. And that's just super special. Like we just really, I want to say now, like publicly, we really appreciate that, because
Mhm.
it's really rare to find people who just have your back no matter what. And even though you and I are both civilians, I feel like we care so much about this mission that it's just natural for us to fit into this conversation the way we do. Would you agree,
Yeah,
or?
and that's like, isn't that what everyone needs, right? Like part of like our own healing and our own path is working to become the person that you needed and working to become the person that other people, need you to be. And that's part of, my own self-improvement goal too. I want to show up as the type of person that I needed when I was younger and the type of people that I think other people need for me. And that's me showing up with unrelenting love and support and understanding for people and not having all the answers. I mean, that's rarely a part of it, right? Is knowing everything, but just being in a supportive community and knowing that, whatever it is that's coming up, that we can talk through things and figure it out together and nobody has to suffer alone. So just orienting, I think, from a place of genuine just love and support goes such a long way, especially when we're building something. We're not quite sure how to build it or what it's going to look like, building the bicycle as we're riding it, all those, metaphors for startups and building a business. And it's just, we allow it to unfold and do our best with it. That's really what I try to bring.
You I was I'm just constantly amazed, like you, the way you see the world. And you'll tell your story a little bit, please, because you were a clinician, and I still see you through the lens of like a holistic clinician myself. That's how I view you, I guess, even though you're not practicing anymore.
Mhm.
But you bring such a unique paradigm. Even, when we talk about freedom, like you have helped me, as you've kind of shared, like, hey, that thing that you just wrote, maybe try rewriting it this way, because you're just like constantly, the paradigm you possess is something that everyone could benefit from, just like copy pasting into their own mind. But
Mm.
what is it about that? Like, how do you summarize your story, and then like how you got to this place where you so eloquently, you're not spouting facts, you're not, I can tell it's not rhetoric, it's like so genuinely from your heart as to why you believe the way you believe about things, mental health, the system, people.
Yeah. Yeah, so why don't I like go into my story a little bit and if I don't answer the questions you just ask them again and
Just a
I'll
chat,
go
yeah.
from there. Yeah, so I started as a mental health clinician in community mental health clinics in the Portland, Maine area. That's where I'm from. That's where I went to graduate school, and that was around 2012, so about 12 years ago. Is when I finished that program, started my clinical work, and began my journey as an aspiring mental health counselor or clinician or psychotherapist. We use a lot of these words interchangeably in the profession. They all really mean the same thing, right? Supportive healing work, one on one or with couples and families. And I thought So I became a fully licensed clinician at 25, which is about the kind of like the fastest you can do it. So this was something I committed to in high school, and I had losses in my life. So every therapist or counselor, everyone who does healing work has a story as to what sort of brought them to the work. So for me,
Right.
it was a lot of loss, loss to suicide, loss to just like unexpected death in my families. And a lot of it was unspoken and not really processed. And so I was craving a place and an identity where I could talk about things and process with people and understand myself better. And so I went to graduate school and I became this person who was equipped with some of the skills to do that. But as anyone who has gone through, these training programs knows, you just are barely scratching the surface once you graduate from these programs and do all these thousands of hours. So I thought I was going to do this work forever. I thought I would always be a therapist, always be in clinical practice. The only thing I wanted to ever do was get better at that craft, because it really is equally an art and a science, and it's a
Yeah.
beautiful, beautiful work. However, my plans got foiled, as I think a lot of people's professional plans do. I had to wake up to the system that I was a part of around me. And unfortunately, it wasn't working. And I internalized that for a long time, that I was just a bad clinician, that I really should not
Mm,
be in this profession because it's clearly not working. I'm not making enough money. I'm getting burnt out. I'm getting physically ill a
mm,
lot and not understanding why. And there's a myriad of other reasons that, I talk and write about often. But push comes to shove, it just wasn't working. So I had to have a difficult discussion with my then boyfriend, now husband. Like, listen, this is like some difficult decision has got to be made here. So I made a decision to do something different, and I pivoted and I started working for health insurers, which was like, I got told I was selling my soul to the devil when I made that decision. And I understand, why my peers and colleagues may say that. But I learned a tremendous amount by being willing to put myself in new environments and really look around and just try and understand before I made judgments about what I thought was happening. So I think, to your question about how have I arrived at sort of the thought process or the orientation or the frame that I arrived at, it's because I've put myself in a lot of different environments, and being willing to walk away from environments that weren't serving me any longer. That's been a really big part of it. So I've been around to some different places and been able to see the system, particularly our mental health system, and particularly in the Northeast, and like Maine and Massachusetts, New Hampshire, et cetera, and learned, what it's really like, how clinicians are really being treated, and then also, in like the tech and private sector rather, the level of exploitation that can happen, for the sake of profit, right? For profitability and just endless greed and capitalism and all of that. So it's been a journey. I haven't been in clinical practice for about 6 years now. And I've been doing other like clinical operations stuff. I was in quality improvement for CMS program for a little while. And now I'm working for actually the state of Massachusetts in a disability, reviewing like folks who are coming into needing disability services and things like that. So the one great thing I think about becoming a clinician is that if you are able to get, a license, there's lots of things, portability, different things that you can do with it, that I think folks who aren't licensed unfortunately don't have access to. So I am very, very, grateful for the training, for the experiences that I've had. But there's a lot to unpack in these systems that are harmful. And I think stepping away, truly stepping away from clinical work, doing other things, figuring out who I was as a person now, like who I am at 29, 32, 36 now, has been really helpful in being objective about what this experience has been like in this industry is very different from who I am as a person, and the gifts that I have. So yeah, so I think that's largely part of why I'm able to sort of think differently, as I really have tried to zoom out a lot in my experiences and look at the bigger pictures.
yeah. we talk a lot about, WTO being a whole less, holistic, and that's a word that just gets kind of thrown around as a buzzword, I'm afraid, but we really mean it when we say it. What does that word mean to you through your own lens? And because you're on our board, we could just assume that's what you're trying to help us implement, through WTO. But what does that word mean to
Yeah.
you? What does it mean to practice holistic health, to look at the whole person, and having that open mind to any possibility being, I don't know, what does it mean to you?
Yeah. So by definition, right, and you already said it, holism means looking at the whole of something, right? Not just our parts. And I think, why this idea about holistic health is so new to us is because we've been conditioned towards our Western medical model of treatment, which is breaking down the body and illness by systems, right? Like you're going to the oncologist for cancer. You're going to the gastroenterologist for your gut. You're going to the cardiologist for your health, right? Et cetera, et cetera, et cetera. And that works some of the time, right?
When
It
it
works in
works.
certain circumstances and situations, and it works a lot of the times fairly well for medical issues. But when it comes to more nebulous, metaphysical, spiritual, mental health, the mind, it's a lot harder to have that sort of reductionist compartmentalization to how we work with ourselves. So holistic health is really looking about the whole system, right? And so like some of the things that I will now write about or talk about are not things that I ever learned in school. There are just things that I have learned along my way of continuous evolution and trying to pay attention and taking a really objective view and being willing to say, well, I was really trained to be a cognitive behavioral therapist. That's mostly what my training was, because it's easy to deliver, it's easy to administer, it's fairly easy to learn. But that's rarely what people need who I got in front of. Some of the times CBT was very effective, but a lot of the times that's not the type of therapy they needed. And some people didn't even really need to be in psychotherapy at all. And by that, I mean, there was other interventions that probably would have been more helpful to them.
Right.
So holistic means we're willing to look at like any possible way to help healing occur, right? So it's like, if we're having a lot of issues with anxiety, is a medication helpful? Maybe. Is therapy helpful? Maybe. Is working on our nutrition, our diet, our, our gut health, our microbiome, is that going to be helpful? Maybe, right? It's being willing to consider that there are many, many different ways to help our mind and body towards healing. There's rarely one right way. There's rarely a gold standard for how we help ourselves heal holistically. It's really about just being willing to try new things and see what works uniquely for you. Because I guarantee you, like the thing that works best for your best friend or your sibling or your parent might not be the thing that works best for you. So it's you're being a scientist, you're putting that detective hat on. And I think as an organization or as collectives of people, we really want to build this psychological safety where we're not telling you what to do, right? We don't want to be like patriarchal and saying, this is the answer, you need to do this. We want to empower you to be on your own journey. You're on your own journey here, and you're really the only one that can decipher what's going to provide the best level of healing and support for you. And that doesn't mean we do it alone. We do it in community with one another, but it truly is sort of a journey of empowerment that it's on you, right, to figure out what's going to help you heal best, and nobody can claim to know that for you. So I find that very freeing, very empowering, and I think a lot of other people do too.
And it's part of that empowerment is like you not only should make, some of these decisions, but you can do this. Like your body knows what it needs. And so that's, I think too, one thing as you're talking and getting into some of like what WTO does that I think really makes it special and unique is that people aren't coming to us as a nonprofit to a counter that if you just look at, if I visualize how most nonprofits operate is that the veteran comes, here's a counter, which is the program or service, and the person delivers that service. And then they either stay for 6 months or whatever, and then they go, right? And whereas WTO says, hey, there's no counter here, we're people. And what we don't want you to do is just buckshot approach. Like holistic health effectively is not going to just be like, maybe that would work, maybe that would work. I heard Brittany on Freedom Friday say maybe this would work. Maybe I'm just going to try all these things and hope. like that, there's a intentionality and a focus that you can add to holistic approaches that leads to success. And that's where our relational component comes in through family advocacy, through all of the community that you talked about. So as soon as someone joins, they might have, Tara as a family advocate who was on last week's Freedom Friday, but
Nice.
they also have access to our community. And I know if a veteran said, "Hey, can I really speak to someone like Brittany about this? I'm really curious about that." Or, "Hey, can I speak to Gabe about this? Hey, I need to learn about hunting. Maybe that's part of my mental
Yeah.
health recovery," right? And
Yeah.
so, that relational component adds momentum and energy behind the right choice within all these infinite choices, I think.
Mhm.
Is that making sense?
Yeah, absolutely. I think we want to assume that individuals know themselves best, right? And we can rally around them, right, with our knowledge and backgrounds. And we have really diverse folks at WTO, and it's really wonderful. And that's really necessary, right? To have this well-rounded approach, to have this holistic framework to say, we know that you know yourself best, and tell us about that, and let us help maybe guide you, give some ideas, some options. But ultimately, right, we want you to trial this and see. And that doesn't mean that we're not interested in data and knowing what works for people. I think we very much are,
Mm,
interested in tracking how people respond, to the various like interventions and things and that we're rallying around. But we do want people to be self-led. And I think that's where, our paradigm in the traditional medical system has really kind of gone wrong in some ways, to not put too fine of a point on it. I don't think people really become their best selves when they're told, take this, do this. We're overly prescriptive, I think, in our society about what people should be doing. And so really orienting around that aspect of freedom, of self-determinism. We're talking about veterans. These are people who are used to being very independent, highly skilled, really smart folks. And I believe that they have a lot of the answers inside of them, as most people do, about, what they need most. And it's an evolution and a journey that we're all doing together, because nobody's fully healed. Not one person on earth is fully healed. So we're
yeah.
all doing this work.
Well, I think one thing that I love about you and that I think we align so well on is, that veteran category is just that. It's not an identity, it's a category, or it's not, I don't even know if that's the right word, but it's something that we can say, yes, you did that. That's part of your story, but it's not all of who you are, right? So when we look at people, you and I, we look at humans. That's truly holistic, is to look at the human. And I've said before on, I think, our first Freedom Friday, like, you're a human first, not a veteran. And that's
Yeah.
a status. That's the right word. That's a status in my mind, and not even a label or category that I want to give you. Because as soon as we start getting into labels and categories, things start to get like, oh, this is how they are. Right. And so
Yeah.
coming at it from a human perspective, I try to help people understand, like, when you think about as civilians, I don't sit around as a civilian and think about what are all the resources at my disposal right now. My friends, when I have a problem, don't say, "Gabe, I've got 1,800 resources that could solve that for you right now." They just listen, or or whatever. They just listen. That the
Yeah.
best friends I have just listen and sit there with
Mm.
me.
Mm-hmm.
And that is more like helpful to me through those things than any level of like countertop, here's everything I could do to help you. And oh, by the way, like you said, go do it. you know, it's like
Yeah.
when helping hurts.
Absolutely. And we get this wrong all the time. And I think there's a lot of reasons for that. One is that we just really want to help, right? So it's kind of like our natural instinct when
Right.
somebody is suffering or somebody is going through something, we want to offer solutions. What about this? Did you try this? Did you try that? And it's coming from a loving place, but often it has almost an opposite effect. It often ends up making the person in need or the person who is struggling feel judged, or feeling less than, or feeling like they're not really being heard. They're being sort of maybe preached to or being given a lot of advice. And I think actually people rarely need advice unless they're explicitly asking for that from us. I think this is something that counselors and therapists do very, very well. You'll have people explicitly asking for advice. And I think a sign of a good clinician is that they will not give it to you. They'll ask you questions to
Mm,
get clearer and deeper with what's going on inside of yourself, rather than giving you some sort of prescription or blanket advice about how to handle something. Because we truly do need to arrive, right, ourselves at the right answers. And no one can kind of know what's right except us. So yeah.
yeah. We were talking just before I hit record, and I hit record so we could capture some of it, but it might not have made the podcast. So I want to make sure it does. But about this new thing that, I spent a lot of time, Britt, sitting with what is the counter narrative to the broken veteran narrative. Right. I've sat forever. Like, I just had a feeling like there is a word that is going to come to me. And I remember I've talked with hundreds of people about this. I went to a conference in Vegas and was talking with them, about it there, that we need a counter narrative. And so in the warfare of narratives, something has to start competing with this, PTSD, suicide, all this stuff, that the first thought of disability, the first thought of veteran is any of this stuff. And victorious came to me almost like this, it's like victorious is the word, like this summarizes from the moment they signed the dotted line, from even from what led them to the recruiter's office or whatever, like this is who they are inside. And that gets back to that empowerment afterward. But you mentioned seeing like a post I put out recently too. But what does that kind of mean to you? Why does it stand out? Why is it important to start engaging in this way? Because it's not getting all the play, it's not getting all the likes, it's not tapping into the algorithms for all the best things for our nonprofit, right? But it's necessary, I feel. What are your thoughts on all that?
Yeah, I mean, I think that fundamentally people do not want to see themselves as broken, as damaged, as fusing their identity with a diagnosis or even a role that they played. I think we as human beings are something completely, if divine is a word that resonates, something that's soulful, spiritual. Who we actually are is something completely higher than the experiences that we have in the world, in our bodies on this earth. And so I think a lot of it is about trying to tease away that objectivity. And I think, like mindfulness practices have helped me do this um, fairly successfully at times, and really separating away all of our social conditionings and the labels and how we're broken or flawed, that those are actually pretty inaccurate. Actually who we are is who we were when we were probably 4 or 5 or 6 years old as children, and the world had not really gotten to us yet, that we were free to have our passions and our interests, and we were uninhibited in the questions we asked, and our curiosity and our willingness to extend love or receive it or seek it out. I think most of who we genuinely are is probably buried into an inner child that still exists inside all of us. And a lot of, I think, the work, I can only speak for my own healing journey, but a lot of it has been finding our way back to, that place where we were really could see our own gifts, and trying to unfurl all these layers that we've learned as adults and as our life carries on, to really let those things inside of us grow and shine and be that light, and live in our light, rather than, I wrote this line the other day, find our way to live in our light rather than, merely survive the darkness, which
Mm,
is, I think, a lot of the time what it feels like when we have all these negative labels, or, things that really kind of bind our identity. I think our freedom, our highest freedom, comes from, right, detaching from these labels, from these identity structures, from these kind of like, what do I want to say, tropes of illness. Not that illness does not exist, I'm not trying to suggest that, but that we need to be really careful with how we tie our sense of self to these ideas.
yeah, and I get fired up about this stuff because I think there's too many people making a buck off of abusing those things for the sake of their own gain. And maybe they do help some people, kind of like the system that like you talked about earlier, right? The system is this capitalist system. It's kind of abusing people for the sake of its own gain and doesn't help people, sure, right? But 2 to 3 star service in my mind has just been so patted on the back, and I'm tired of it. And I'm
Yeah.
tired of people accepting muddy water, and we need to start drinking pure water. Oh, no way. Did you just drink pure water?
I just started drinking water.
Oh my gosh. We need to start. That was not planned, folks. We need to start drinking pure water because the more you do that, the less taste you have for the mud, right? And
Mm,
in my mind, like I'm so tired of, and there's nothing, I'm staying in my lane. I'm letting it go because it exists. And I'm not going to try to like go like nonprofit to nonprofit or person to person to try to be like shake them out of it and things and to like judge them and things.
yeah.
I feel like people have adopted this narrative, whether they're abusing people on purpose or on accident or whatever.
Right.
They've kind of adopted it, and it by conditioning, through just like the common like stream, and this is how things go. But I'm tired of it, man. I'm tired of seeing like suicide being the first thing talked about when I mentioned that I'm the CEO of a veterans nonprofit.
Mm,
I'm tired of that kind of stuff happening. The numbers being thrown out constantly. I just told a lady who's a veteran who said, she actually had a plan to commit suicide, and back when she was getting out, and she still has tough days. And I actually challenged her. I'm like, listen, I know I'm not a veteran, but I'm your friend. You got to stop saying that your mission to show up to life every day is to prevent the 44 a day.
mm,
And something I've also been thinking about is the difference between an idea and reality. When things are an idea in our mind, we tend to like cinematically like turn it into that. Like we can like we can fill in the blank with whatever our mind wants to come up with, right? It's not always real though, versus reality. So like when you say, yeah, these things are real. I'm not trying to take away from the fact that people have suicidal thoughts or people experience PTS or whatever, but how we deal with it, how we choose to deal with it is on a real basis. Like when someone comes to me and says that, now it's real, right? Or if I'm
mm.
sharing someone's story and that's part of it, that's real. But I'm not going to keep letting this idea of things affect veterans, because you can have like my brother, he's, COO, and he's super high functioning. But if the environment only allows him to be here because people see him as all these things, and veterans also then accept that conditioning from the culture
Mm.
and start to like downgrade themselves in their own minds, and so
Yeah, I think what you're referring to is like embedded stigma, right? Like
yeah,
there are these stigmatic beliefs that are not just irrational ideas that come to our minds. They're actually delivered to us from the way these systems are structured,
yeah,
and the way people talk to us, and whether it could be explicit, right? It could be something explicitly said to you out loud or written on a billboard or whatever, or they can be implicit, inferences from the things people say or how maybe not open they are to talking about veterans' strengths and empowerment and all the what are the pathways of healing that veterans have found so far, and let's highlight those things, right? So there's a lot of embedded stigma, I think, in this system for veterans, and I can really relate to that because there's a lot of embedded stigma in our mental health care system, and that has been harmful even to me as a clinician, um, as well as a consumer. So those are real, issues that we are kind of silent battles, I think, a lot of the times. And one of the most helpful things we can do with silent battles is bring them out of the shadows and speak to them, and shed light on them. And that's often what a lot of healing, I think, occurs is in community, is when we actually are willing to put our energy towards sharing our truth, sharing what's real out loud, or at least with another human being in a way that we can, because it's where the shadows are able to exist is where shame grows, and that's really dangerous when we stay in the shadows where the shame is strong and growing.
yeah. And just to clarify, when you say that that battle is real, you're referring to dealing with and fighting against embedded stigmas.
Yeah.
Right. Not the stigma itself being right. Like, unless it's real, then it's real. Let's say suicide or PTS or anxiety or any of those things. I mean, I think anytime you like focus in on any category of human, could be footballers, it could be men, it could be bearded men, it could be, there's always going to be embedded stigmas in every single category of person that we could come up with. But that battle is real, and I think being open, and that's what we're trying to do as an organization, is to start to bring that into the light, to say, hey, these things are not real. And I've even told people, we've had people come to me within our nonprofit that we serve and say, hey, I've had some suicidal thoughts, but we deal with that on a real basis then, and I empowered them to say, hey, those aren't yours, right? And I don't get scared. Man, I sat through a suicide training. Everyone in that room was scared out of their minds about going
Mm,
to serve veterans. Scared out of their minds about, oh my gosh, what am I going to do when a veteran comes to me? And it's like, you know what? A veteran comes to me, I just talk to them. Hey man, I understand. Let's get to the root of that. And if it's too much for me to handle in terms of like the complexity of it, I might have to talk with someone like Brittany or whatever. But
yeah, yeah.
um dealing with those things as they come up when they're real, it really matters. And yeah, I just appreciate your perspective on that. What other, I know we're kind of getting to the end of our time here, and we're going to have you back on because I'm realizing everyone I'm talking to on these things has so much to say,
Goes by fast, right?
you
An
know?
hour goes by fast. Yeah.
Yep. So, but what other kind of takeaways do you want people to feel based on our conversation? Maybe something new that we haven't talked about?
Yeah, I mean, one thing that I'm thinking about as we're having this discussion about like stigma and what's real and not real is that can get tricky, right? Because perception is our reality. And so everyone, we could easily have 8 billion different perceptions of reality right now coexisting at the same time on Earth, right? So, and our brains are really hardwired to compartmentalize, to say, well, this means this means that. I fit into this category, I don't fit into that category. And we easily, internally can other ourselves, shame ourselves. In our therapy world, we call that a psychodynamic process where, right, our own sort of thought process, the way we feel about ourselves, we contribute to our own suffering a lot of the time.
Mm,
So, regardless, I think of what that looks like for you, I mean, not you, Gabe, the
yep.
proverbial you, everybody out there, is that it matters less about what that process looks like, and it matters more about who you're sharing it with, who you're in community with, who you can talk to, or what kinds of things, you can do to try and help lessen, your own suffering. Because I think that's a really shared common experience, whether you're, like we're saying, whether you're a veteran or not, man, woman, whatever, what your background, we all have these internal struggles, and the pathway to healing is really in community, is in sharing, is in lifting these veils of shame, and how we've been so conditioned to keep it all inside and to act like we're fine all the time, and that we don't have these really deep and persistent pains in life, is to not be forthcoming about what it truly means to be a human being. And I think that that is our, for me, at WTO, that is like our overarching goal, is to help people understand themselves as human beings, and that there's a lot of connection and healing in us just being able to show up authentically, with love, with psychological safety with one another, to talk about the real truth about what it's like to be here on this rock hurtling, through space and time, and living in these bodies that we're in, and these minds that are always, trying to intellectualize everything. It's very challenging. And I think just normalizing how difficult it can be, regardless of, what shade or flavor that looks like. To me, that's really loving and supportive and healing, just to know that there are people who can hold that space like that.
Yeah, great last words. I'm going to list a couple calls to action, but if I miss anything, I want you to chime in with what basis, especially based on what you said. Like, this is the first week I've actually even thought of a call to action, which is funny because I'm a communicator, but I've just been sharing the story, and I usually just let that sit with people. But number one, people can find you on LinkedIn if they're interested in reading all the things that you're talking about. And
Mhm.
you are a great source on my feed of just a healthy reminder of how things are. So Brittainy
Thanks.
Lindsey, right? Just on LinkedIn, correct?
Yep, Brittainy Lindsey on LinkedIn. I also have a Substack publication called Healing from Healthcare. The link to that is in my LinkedIn profile, and we can share it elsewhere if people are interested. Yeah, and I'm an open, connector and communicator on LinkedIn. If you want to have a discussion with me, just send me a DM, and we can either have a quick chat or hop on a call. And I'm always open to supporting and connecting with people who are interested in what I have to say, or topics that I typically write about.
Yeah, and it's just even reference that you watched this video, and this is how we all got
Absolutely.
connected, right?
Yeah, let me
That'll
know
give
that
you
you
some
heard me here. I
context.
would love to know that. Yeah.
Yeah. Otherwise, I would say too, if you're a veteran, if you're a military spouse, if you are a Gold Star spouse, I want to be even more clear because we have a Gold Star spouse in our family now, in our program, that almost didn't sign up because she didn't realize it was for her too. And so
Mm,
I'm saying that every time I mention, veteran, family, Gold Star spouse.
absolutely.
If you are hearing this and feeling like, Warrior Transition Outdoors and in our psyche and our hearts for people, and maybe this is something that you need or could be helpful, like reach out, sign up, just go sign up. Don't even don't even reach out right away. Find me on LinkedIn, Gabe Erickson, whatever is going to work. Just get in contact with us. Any other, subscribe if you're on YouTube. Any other calls to action, Britt, based on, maybe it's less about like the connections and things, but based on what you just said, your final words there, those really good. But something
Yeah.
people can take with them to be more free today.
Ooh, you're really putting me on the spot. Um,
Liquid
yeah.
gold. That's what
Okay, so I'm thinking about my own experience, and like I think before we started this podcast, we were talking about like a year in review in 2023, and there's a theme that came up for me this year that maybe could be helpful for others, which is constantly trying to control everything. I think is a really common struggle that a lot of us have. And when we reach really difficult moments in life, like I had several of them in 2023, we realize how little control we truly have over most things. And to me, the only way to get my freedom back in these really heart-wrenching moments was to like surrender myself to that lack of control. Like, I totally do not have control over this, even though it's terrible and hard or weird, or I want it to be over. And really surrendering to that fact that actually, what would occur if I didn't try to control it and I allowed it to just be exactly as imperfect and raw and gross as it is? Could I just allow myself to tolerate the imperfectness and the lack of control that I truly have over this situation? And for me, that has helped tremendously. That if all I can do is just breathe through it, that is enough. That truly is enough a lot of the time. So.
that's a great call to action. Just take some hearty breaths. Like,
Easier
we
said
forget
than
to breathe.
done, right? Easier said than done. But the surrender aspect of it has been helpful to me.
Yeah, that's awesome. Thank you, Brittainy Lindsey, board member, and so much more. And we'll look forward to seeing everyone next Friday.